You probably know someone who looks completely calm on the outside, even while their daily life moves at a hyper-fast blur. They are highly functional, outwardly successful people, but internally they carry the quiet weight of low-grade depression, high-functioning anxiety, or a relationship that feels permanently stuck. Many of these capable individuals will endure this hidden friction for years without ever seeking professional help. They accept unnecessary suffering simply because of the stories they tell themselves. These people are blocked by an invisible wall, a psychological barrier built from outdated pop culture myths. The largest brick is the belief that therapy is exclusively an emergency room for severe mental illness. People assume their everyday struggles simply do not qualify. By accepting these myths as facts, we take treatable, everyday psychological stress and lock it in as a permanent burden. The most stubborn roadblock keeping people away from treatment is the assumption that asking for help is an admission of weakness or an inability to cope. We do not apply this logic anywhere else. When a professional athlete hires a trainer, or a successful executive brings on a business coach, we admire their commitment to optimization and growth. The reality is that the most resilient people you know actively utilize therapy to maintain their edge. Stigma simply forces them to keep this advantage a secret. Recognizing you need support and bringing in an expert to help navigate it takes extreme self-awareness. It is a tactical decision, and it requires real courage. Then there is the process myth, the idea that therapy means paying a professional to listen to you complain for an hour while they simply nod in agreement. When you vent to a friend, they offer sympathy. When you speak with a clinician, they are engaged in strategic listening. They are trained to hear structural patterns in your stories that you cannot see yourself. Over multiple weeks, a therapist maps your historical thought patterns, emotional triggers, and defense mechanisms. They draw connections between what you say today and last month. Clinicians use evidence-based frameworks, like CBT, to actively alter those habits, producing measurable change. And despite what we see in movies, a successful therapist will never tell you exactly what to do to fix your life. If a provider hands you all the answers, that is a clinical red flag. Their actual goal is to ask specific questions that help you calibrate your own internal compass, ensuring that the insights you reach actually stick. Therapy is a highly structured, operational environment, engineered with clear goals and progress tracking to produce results. Even if people understand the clinical value, a logistical dread often holds them back, the assumption that signing up means an endless, multi-year commitment. Look at this chart plotting clinical data for CBT. It shows a clear trend of meaningful improvement in just 8 to 12 weekly sessions. That is only 2 to 3 months of work. You come in, address a specific issue, build tools, and graduate. Finally, there is the assumption that digital care is a downgraded, less effective version of an in-person visit. This visualization shows the peer-reviewed data comparing the clinical efficacy of telehealth against in-person therapy. The parallel lines prove they match in effectiveness for treating conditions like anxiety and depression. By eliminating commute barriers, telehealth consistently yields a patient satisfaction rate above 90%. Modern clinical therapy has been optimized to fit seamlessly into a busy life, removing the logistical friction that kept people out of the clinic. Skeptics often rely on one final excuse. I tried therapy once, it didn't work for me, therefore the entire system is flawed. Clinicians call this a matter of therapeutic fit. You would not swear off all medicine if you had a bad experience with one doctor. Finding the right therapist takes similar logic. If you did not feel heard or the style felt wrong, that is a mismatched approach. It simply means you need a new provider whose expertise aligns with your specific situation. We are shifting our perspective to treat mental health as a matter of routine maintenance. Waiting for a complete mental breakdown to ask for help is as illogical as waiting for a painful cavity to schedule a routine dental cleaning. If these myths have been stopping you from getting the support you deserve, you can take action today. Visit chctherapy.com to connect with a licensed therapist via secure, HIPAA-compliant telehealth anywhere in Georgia. Most insurance is accepted, including Medicaid with zero out-of-pocket costs. The invisible wall has been dismantled. The rest is up to you.